So welcome back. I suppose that everybody was doing some physical activity or some relaxing activity to the two sessions. So actually the second chapter of today's online presentation, it's about education in lifestyle medicine. So today we have many, I would say many certificates. We have programs, academic programs related to lifestyle medicine, but we don't have, for example, today a specialty of lifestyle medicine, at least not in Europe. So what we tried to do now, I'm really grateful for the members, for the panelists of this section, because they accepted to share with us their experience. And most of us, we are in the medical field here, so we know that in a medical field, there are jealousies, there are egos, there are whatever you want to call. But what we succeed here, because we are driven by the same interest to offer another approach, a global, a holistic approach, a better health to our patient. So this passion probably made us to sit today, and for the first time in the lifestyle medicine movement, we succeeded here at European Lifestyle Medicine Organization to organize this debate. And we will see each one what is the experience, and we will try to find out what are the common goals, what are the common things which we should talk about, because we will be here from Europe, from Turkey, from Romania, from Latin America, from Australia, from US, and from Canada. So we are really going everywhere. So let's say that this is the good thing with an online, with a virtual meeting. So I will share my presentation. Just give me a bit of, just 1 second. So maybe Anka Hâncu, maybe you can start, please, with your presentation, because of course, I have to have a technical problem. So if you are kind to start with your... So Anka Hâncu, she's a medical doctor from Romania with PhD in nutrition. She's a medical director and associate in a Nutri-Science clinic in Bucharest. And she's the president of the Medical Association for Prevention through Lifestyle Medicine. And what is really great about her initiative, in a very short time, she succeeded to publish the first book of lifestyle medicine in Romania. And I think that not many such initiatives, even at the European level. So we asked her to share with us her experience, how she did it, how she realized making big names of experts and related to lifestyle medicine to reunite in at least in the first part volume of the book, because I understand will come a second one. So Anka, please. We don't hear you, Anka.
Ioan, there is also a recorded movie with me presenting the book.
Yes, please. So please do it.
I thought it's your movie.
Yes, if you, yeah, because I just have a bit of technical problems, of course. If it's not bothering you.
Just a moment. I will start to speak, and then maybe I will show it. Here is the book. The book, yes. And of course, I am very proud about this book. What is interesting, and I will start telling that future belongs to those who believe in the beauty of their dreams. This is what Eleanor Roosevelt told us. Past year, I have been in Rome presenting four posters at the Congress, at the European Lifestyle Medicine Congress. And it was just an expectation, a dream, to show something more concrete in this part in lifestyle medicine. So this year in summer, it became this idea to put all specialities together in order to have how lifestyle influence non-communicable diseases. So this book is lifestyle medicine and chronic diseases. What I have done, I had a partner, a professor, a pneumologist. I am a nutritionist, so a medical doctor. Together, we found partners in cardiology, in diabetes, in pneumology, in nephrology, oncology, primary assistance, in order to build a book about each specialty. We started with genetics or lifestyle in order to see if genetics can be battled by a good lifestyle. Of course, we defined lifestyle medicine, and then every chapter was written based on a draft given for each author. What was this draft? This was the draft was firstly to define the disease, to define the prevalence, global evolution, and evolution in Romania. Then to see how lifestyle is as a risk factor for this disease. Then lifestyle as prevention. Then lifestyle for managing the disease. Lifestyle and comorbidities, medical nutrition therapy, other recommendation for lifestyle related to this disease, also a paragraph about the COVID impact on this disease, and conclusion. A few days ago, on 25, we organized conference and we launched this book, and each author had the opportunity to present his work, to present practically the influence of lifestyle on each disease. Also, Professor Diculescu was together with us. So this is our book. This is what we have done. And it is very important that we started from a point, and it's important that this book, this event, this conference increased awareness about the subject of lifestyle medicine. In Romania, it's the first time when such a subject was presented. At the conference, 731 medical doctors registered, and they will receive also the complete recorded of the conference in order to be able to catch any presentation or movie if they were not able to see the whole event. If you have any questions, or I still have some time, Ioan, or?
Yes, please. So you have, I know, a little short movie. Let's see if there are some questions also.
You can, or I will introduce also maybe the movie.
Yes, please.
Immediately. was important for this book and for the future specialty, that cardiologists, diabetologists recognize the importance of lifestyle and recognize that practically they didn't pay enough time to this subject. And we discussed further with other cardiologists, for example, to know more about that subject and to maybe to build alliances between nutritionists, between cardiologists, diabetologists. Practically, it is about multidisciplinarity, enthusiasm, and creativity. This is how I define the concept of lifestyle medicine. I am waiting my movie now.
If not, I will just, if it's, it's always the one who is organizing has the most, I mean, often the organization problems, but okay. So if not, I will.
The movie is here. Oh, it's not yet.
If not, I will just.
You can present and I will come back with movie later.
Okay, so it's visible, the presentation?
Yes.
Okay, so everybody can see it. So my presentation, it's about the experience what we had here in 1 year of the European Lifestyle Medicine Certificate. Maybe you are asking what is with these childish figures. So actually, we had, with our certificate here, we are one of the children in the lifestyle medicine. And we are having 1 year, so this is why I permitted myself to use these funny figures to do the presentation. So now, last year in 2019, we have a lot of great certificates. So we have the American one, we have Canadian one. So we are asking ourselves, do we really need a European one? And after a talk in the board of European Lifestyle Medicine Organization, we arrived to the conclusion that we have some specific some specificities at the European level. So we are so many nations, so many cultures, all with their own rich food culture, with their different type of everyday habits. So this is why we try to find something what is typical, specific for us. Then Mediterranean diet. So Mediterranean diet has thousands of articles which are showing the benefits of Mediterranean diet, of the Mediterranean way of life. As we know that diet means in Greeks, and we are happy to see that we have many people from Greece as participants. And then we ask also ourselves, what else we can still talk about in the chapters of lifestyle medicine. So this is how we arrive to have sexual health, for example, in lifestyle medicine. So for the first time, we are talking about this aspect of everyday life. Then we have environment. We have also other chapters, like, for example, more and more it's present the new one, which we will have a chapter, it's lifestyle medicine for children and families. So also something which is really a contribution, a European contribution to the global lifestyle movement. Afterwards, of course, we are a small organization, we are a young organization, and we thought, okay, what we can organize. So let's do something what is different. So this is why we started the course like an interactive course. So the online lectures are online, and we really appreciate the interaction with the participants. Of course, we cannot do big events. So this is why today we are really happy that we could organize this. But the interactive part of our course online is something that is highly appreciated from the feedbacks. Afterwards, we have experts in the field. You met them online already in the chapter of nutrition and physical activity. As you see, great presentations, very practical and up-to-date information. So these experiences we wanted also to be included in the certificate. As I mentioned, the first time was in September last year, and was a joint action between the Belgian Lifestyle Medicine Organization and the European Lifestyle Medicine Organization. And we had a really small group at the beginning, only 10 brave people who said, okay, let's see what is this about, from 7 countries. And I would like just to show them, because we met at the Congress of ELMO that time, so it was actually the first and the last time we could organize the session in the certificate live. And we really, well, we are waiting for the food there, so don't look, please, to the glasses there. And even if you see some alcohol, was red wine, so that it's allowed in the Mediterranean diet. Now, this experience and this interest, what we had, made us to go further. So we did mistakes, we learned from each other, we improved. So every time we try to offer better educational experience. And what is this course about? So we have, from 1 session per week, we arrived to 2 sessions per week. So they are usually in the evening from 7 to 9 p.m. We even arrived to 7:30 p.m. because we have so many things to talk about, to share. Then in this moment, we don't have a manual. So this is why I'm always welcoming the good manual. But the curriculum, what we used, it's the European Lifestyle Medicine curriculum, which is synchronized with other certificates curriculum. And being an interactive course, a 75% online presence, it's required. So in total, you should invest 24 hours and with the course, so they are 8 weeks. And then you have some personal work. So this personal work, it's something which you see here. So the personal work, we are divided in working groups. So with different backgrounds, different cultural backgrounds, different professional backgrounds, because the idea is to encourage the multidisciplinary team of a lifestyle medicine practice. Then each one should develop a SMART objective during the 8 weeks of course to improve the lifestyle, her personal lifestyle. And this action, it's actually something which people are telling in the end of the consultation, of the course, when I'm asking, okay, how went this SMART objective? That's look, I didn't even think that I still have things which I should improve. And the fact that I was constantly in contact with other people who are trying to improve, that we get the information, we get the practical tools, it's something which really improves my personal life. And we know that today, the personal care of the health practitioner, it's something which we should incorporate and practice it every day. And in the end, in the last 2 weeks of the certificate, I invite each participant. We have a 1-hour face-to-face online meeting where we talk about the evolution of the SMART goal. They have to share a lifestyle medicine related case. We talk what you liked, what you disliked about the course, and a bit the story, what you have, what is behind your interest in lifestyle medicine. And these conversations are personally for me a very rich experience, and also the possibility to be present in the moment when, let's say, people say, okay, Ioan, okay, it's enough about you. We would like to hear also another opinions, another expertise. So this is why People from the certificate and other ELMO experts, they are the so-called guest speakers. So each week we have 2 guest speakers from the ex-members of the certificate, and you will see a few of them also in the course, the conference here, but also ELMO experts from Europe and also from US and from abroad. Until now, we have 21 guest speakers from 12 countries. And it's also the certificate, it's an opportunity to develop a European lifestyle medicine network, because this is why we are here. This is what we tried to contribute with our expertise to the global movement, as I mentioned. And until now, in the course, we have almost 100 people who participated in the course. So they have, I just counted these days, 27 medical specialties, but also paramedical, also coaches, also people who would like to change career, people who are just really, really interested to live their life differently. And the ambition of our certificate is to teach the people who are interested the language of lifestyle medicine, because as you know, as we speak here in Europe, many languages, and we speak here in English in this conference. We learn the basics, and then it's up to us using the tools, the practice, to develop our knowledge. And in the end, I would just like to close with two thoughts. So one, it's coming from very long time ago. So it's an Hungarian medical doctor, physician, Ignaz Semmelweis, who actually probably most of you know that actually he was inventing the washing hands like a prevention of chronic disease. And we see, unfortunately, today that these past practice, how important it's for our future. And he was a person who born too early for his time. So this is why today we use this experience, the Semmelweis reflex, so the tendency to reject new evidence or new knowledge because it contradicts established norms, beliefs of paradigms. So it means that, yes, we are very convinced today about the importance of lifestyle medicine, and we try to build something. Sometimes people look at us, okay, we are stranger, you are the guy, the doctor, the professional talking about lifestyle, but yes, what we are doing, and we are at a good direction. And the second important thing is coming from Winston Churchill, was saying that never let a good Christ go to waste. So we are living difficult moments. We are really challenging. We don't know what our future will be, but definitely, for example, now this opportunity with the online meeting, it helps us to change ideas. And I hope in the end of this chapter, you will leave with more, with a better motivation, as we talk often in lifestyle medicine, with more energized that we really can change something in lifestyle medicine. So thank you for listening to my presentation.
Thank you, Ioan. And with your permission, I will start to share the screen and to put the movie.
Please.
Before that, I want also to answer that the questions that raised during this time. The book will be available probably in English as an e-book on the site, on the ELMO site, but not yet. It was just out of, and now the movie. I don't understand.
You have to choose the sound when you choose share Anka.
1 year ago at European You can hear? in Rome,
Yes.
there with some posters, presenting these posters. And it was the dream to bring this concept in Romania. In 2020, I succeeded to develop the Romanian Association, Medical Association for Prevention and Through Lifestyle. This was a great achievement, and it is like Eleanor Roosevelt told, the future belongs to those who live in the beauty of their dreams. What is lifestyle medicine? It was defined in Romania as a new concept based on what Professor J.T. and Professor J.T. told us many years ago. In this context, I had the idea to build practically a book. It is a great book. Of course, it's great, it's mine. It is a great book about lifestyle medicine and chronic diseases. I had great partners, Professor Mieghem and me. We are editors of this book. And together with 12 specialties, we put together a lot of information in important chapters. What is detailed in each chapter? The definition, prevalence, global evolution, and evolution in Romania of each disease. And here we are speaking about diabetes, cardiovascular diseases, gastroenterological diseases, oncology, pneumology, and for each disease, definition, prevalence, lifestyle as a risk factor, lifestyle for prevention, lifestyle for treatment, and also lifestyle for disease management. About comorbidities, about medical nutrition therapy, about COVID impact, because also this SARS-CoV-2 infection had a lot of negative impact for each disease. And it is very well known that quarantine affected in a wrong way lifestyle, and it could be described like an obesogen period, this quarantine period. So now it is a launch moment because some days ago in an impressive conference where Ioannis, Arkadianos and Ioannis have been present, we launched this book. It is practically a first manual of lifestyle medicine launched in Romania. And I will detail for you all the subjects. We are speaking about genetics or lifestyle. We are speaking about obesity and lifestyle. Of course, it is well known the impact of Western lifestyle, for example, in developing obesity. About hypertension, cardiac failure, chronic ischemic disease. About dyslipidemia, diabetes, pneumology, COPD, smoking, sleep disorders, endocrinology, gastroenterology, oncology, and primary assistance. All the future plans that could be built on lifestyle medicine are interpreted here, and we see now a future because we developed a team. This was the most important achievement of this book. We created this team of professors of very important personalities in Romanian medicine, together with their young doctors, which learned in this process. It was a great effort, but a very fast and enthusiastic effort. And now we are in the moment of happiness to have this great book. It is also the moment of thinking for the future. It is probably this book will be translated in English and will be available on ELMO site in an electronic version. So I am here looking for your questions. Thank you very much.
Thank you, Anka, for the presentation. We will see in the debate about the questions. So now we invite Professor Dr. Karner Mutafoglu. He's a coordinator of the Lifestyle Medicine program at Izmir University of Economics School of Medicine in Turkey. And he will present us, talk about lifestyle medicine education in Izmir University of Economics School of Medicine. So, Professor, please.
So, hello, and thank you for this wonderful opportunity for being all of you. I'm just trying to share my slides. Sorry for this waiting pause. So, okay, it's here. Can everyone see the slides? Not yet?
Not yet.
Okay. Interesting.
So it seems that in our education, technical issues are a bit reflecting the difficulties also in real life.
Okay, I'm back and now trying to share the. Is it?
Yes, now it's sharing the screen. Thank you.
Okay. So, hello everyone. Good afternoon.
Yes. And
I need to make it. Okay.
Yeah, thank you. Perfect.
So thank you for this opportunity for being with all of you and sharing opinions and experience and warm greetings from Izmir. We're located here just across the Greece. We're very close neighbors. So in my time, what I aim to do is give a very brief history of our medical school, and then a brief outline of the undergraduate medical education. And then I will be telling you about the aim and how we are trying to integrate lifestyle medicine into our undergraduate medical education. The university was founded in 2001, but the medical school was founded only in 2014. So this is a brand new, very young program actually. So I can say it's a toddler. The program is a toddler because we have just completed the first 3 years. And we have got our first students only in 2017-18 academic year. And as I told you, it's a young program aiming at socially responsive and progressive curriculum. When it comes to the epidemic of lifestyle-related chronic diseases, of course, Turkey is no exception. You see the top 3 killers in our country: cardiovascular diseases, cancer, and respiratory diseases, mostly COPD. So as a response to this reality, to this challenge, we were interested in developing a lifestyle medicine curriculum with an aim to have tomorrow's doctors living healthy themselves and be role models for the community, and also have lifestyle competencies to prevent and manage lifestyle-related disorders. A very brief information about our program. In Turkey, we have 6 years of medical education, undergrad medical education. The first 3 years are preclinical years, and 4th and 5th year is clerkship, and the 6th year is internship. So what we aim was to build an overarching team, spirally integrated throughout these 6 years. The first 3 years have 3 basic courses, which are scientific basis of medicine, clinical basis of medicine, and human society and planet, and the other years are clinical years. So this is briefly how we are taking this impact. Undergraduate medical education has 3 phases. Phase 1 is about normal and healthy structure and function. At this phase, actually, we are talking about determinants of healthy lifestyle from a both individual and public perspective, as well as a global perspective, and their impact on overall health outcomes. Phase 2 is about mechanisms of defense and mechanisms of disease and defense. So this phase, we're trying to define the role of lifestyle factors in the pathogenesis of these chronic diseases and address these risk factors while discussing diagnosis and management. Phase 3 is the clinical phase. So we are aiming a lifestyle first approach in prevention and management of these lifestyle related chronic disorders. Learning objectives are demonstrate knowledge and skills to practice and promote a healthy lifestyle behavior and self-care, perform lifestyle-focused history, physical examination and testing, and assess readiness of the patients for change and guide them to initiate and maintain behavior change, integrate lifestyle interventions both as preventive and therapeutic measures in their clinic practice, of course, define the indications for referrals and advocate strategies to improve lifestyle in community. So what we do is we start at the end of the first year. This summer and at the end of the first year, we give first an online lifestyle survey to the medical students. This survey is developed by our own faculty and it has 122 questions, including nutrition, physical activity, sleep, tobacco, alcohol, smartphone usage, stress management, and self-care. And after getting this online survey, all students are asked to complete a lifestyle medicine online course, which is the reduced content, which is adapted from this lifestyle medicine course, generously provided by NextGenU. So I just want to take this opportunity to thank everyone who contributed this really wonderful course. And after taking this course, reduced content course, because they're just first year students, so they're asked to prepare a brochure for public education. Here you see some examples of the student brochures. It's in Turkish because, you know, it's for public education, although the language of education is English in our school. But I think the main difference is having an exclusive lifestyle medicine course at the second year. After coming back for the full semester, the students are every week on Tuesdays for 4 hours, we have lifestyle modules. 2 hours of interactive lectures and then 2 hours of practice. And we are trying to integrate different knowledge and skills throughout this lifestyle medicine course, which are also relevant to lifestyle medicine practice. Teamwork skills, communication skills, constructive feedback and reflection skills, critical thinking, clinical decision-making skills, and project planning and management skills, as well as professionalism. So these are the learning outcomes for the second year's course. However, I won't be going into the detail. If there are any questions, I can come back. I can briefly say that the students who complete this second year curriculum are expected to gain an individual and public perspective, as well as a national and global perspective on lifestyle medicine. And equally importantly, to develop a holistic approach while practicing lifestyle medicine to avoid victim blaming. So these are the main themes of this course that we give at year 2. Now I'll be telling you about with some pictures. So we start with an introduction week, and after these 2 hours of interactive lectures and introduction of the curriculum, students who have already completed this reduced content course are asked to prepare a presentation to tell others about what this lifestyle medicine concept is. So it's really fun. They're very creative. In this first picture, this lady was making a rap music, just initiating their presentation. So, you know, young people are really very creative when they are given the opportunity. And we have 2 different nutrition weeks because nutrition is really an important issue. The first one is about a healthy and balanced diet, where we are talking about a lot of diets all around the world, like, you know, there are very popular diets like, you know, ketogenic, etc. So there are many questions from the students. And then after that, we have a small group work, again, my plate, where they discuss with their group and present their plate to the whole audience. And the next week is exclusively about Mediterranean diet. So as most of you know, the west part and the southern part of Turkey is within the Mediterranean basin. So the area where we're living is, you know, very lucky. We're having a very wonderful nutrition environment. This is why we want to focus on the benefits of health benefits of scientific benefits. I mean, health benefits using scientific evidence, giving, you know, examples from prospective randomized trials, large cohort trials, etc. We've discussed the issue, and at the end, all students are asked to prepare a poster for the public, telling them about the health benefits of Mediterranean diet. So another week is about physical activity. This is really fun. Our students really like it, followed by sleep and health. And we have team-based activities, case-based group studies followed after these, you know, presentations. The issue arising here, as you can imagine, is time constraints of the medical students. They want to be physically active and they want to have a healthy sleep. However, they are saying that we don't have time, and we are discussing what's the best option, what can we do under given circumstances. You know, I was just asking them to stand up and jump for 3 seconds during the interactive lecture, so I can see, I'm happy to see that it is really helpful, even though we don't have time for long physical exercise. And again, stress and well-being, another module. We are here addressing the issue of stress management, and we are also pointing on medical student burnouts and preventive strategies. We're experiencing a little bit mindfulness meditation, talking about the scientific evidence on it. And then we have lifestyle and epigenetics. We're talking about factors, our lifestyle factors that affects our genes, and nutrition and epigenetics, particularly focusing on cancer relationship. So after that, there's a small group work, which is called From My Plate to My Genes, and they present their work, small group work, afterwards at the 4th hour. So they're picking at least 2 micronutrients that affect either DNA methylation or histone modification, and define food sources for these nutrients, and draw a simple concept map to show their friends about the epigenetic effects of these nutrients. So Tobacco and Alcohol Week. Tobacco smoking still remains a public health issue, unfortunately, in my country. And we're talking about the health consequences of tobacco use. Unfortunately, there's a lot of young people smoking. So we're talking about ways to quit and fundamentals of tobacco cessation and consuming alcohol in moderation. Following this week, they're visiting smoking cessation clinics. We have some community-oriented experience on lifestyle medicine during the course, which is very helpful to see what's going on in the healthcare system, in the primary care setting, in the secondary care setting. They're also visiting obesity units, family health care centers, and some mobile services. These pictures are taken during these visits, and the students are really very happy to be there. We have 2 panels on lifestyle medicine. 1 week it's on adults, and the second week it's on children. So we invite clinicians who are, you know, practicing lifestyle medicine interventions while evaluating and managing their patients. So they share their experience with the students and they discuss ideas. So pediatrics, my background is pediatrics. Actually, I'm a pediatric oncologist. So I do believe in, you know, starting these interventions during childhood, because, you know, changing an adult is really, really hard, as you know. And then we talk about how to set smart health goals. So we talk about smart goals, and then the students make a reflection on their own lifestyle. And then they're asked to prepare a goal setting worksheet for the next year. This is just around the New Year's Eve. It's like, New Year's resolution. So another point, this is the individual approach, and we then focus on population-based lifestyle medicine, population-based programs on lifestyle medicine. And after discussing the various population-based programs on lifestyle from Turkey and from the world, they are asked to prepare a group project for a population-based lifestyle medicine program, and then they discuss it and present the data. This online survey is not only given to medical students, but we give this online survey to all the university students during enrollment to the university. So these online courses results, the statistical analyses are, done by our students with the help of our instructor, and then they discuss the results, and depending on the results of this lifestyle survey, they are asked to plan healthy campus activities.
Only 2 minutes, please. The
okay.
last minute. Thank you.
The last 2 slides is about how we are integrating. This is just an example. So I picked one of the main courses as a model of integration. We have one course called Clinical Basis of Medicine. For year 1, for example, there are anthropometric measures, vitals, and basic communication skills relevant with lifestyle medicine. Year 2, there's communication skills and examination skills. So lifestyle medicine is integrated into these education and training. And year 3, we have clinical reasoning sessions where both diagnostic and therapeutic reasoning specifically includes lifestyle medicine. And during the exams, we address lifestyle medicine outcomes directly. 4th year, we just started, so this is just a plan. It didn't come true. However, we are planning all our students during 4th and 5th year, and also internship, to integrate this knowledge and skills while evaluating and managing their patients, and exams go on addressing these learning outcomes directly. So this is the contributing faculty for this semester. So I would like to thank all of my colleagues who really devotedly worked to make this happen. And the last picture is from a Slav city, Slav town in Turkey. So it shows that there's a way to live healthier. Thank you for all your attention.
Thank you, Professor Mutafoglu, for the presentation and the great work what you do there. And let's hope that if we can travel again, we can visit there also, seeing on live what you presented here. Now I invite Dr. Carla Arancibia from Peru. She's a medical director, director of Latin American Lifestyle Medicine Association, and professor of lifestyle medicine specialty at Ricardo Palma University in Peru. And she will share with us the medical education experience in Latin America. Welcome in the conference.
Thank you, Dr. Ioannis. I'd like to share the file. For the invitation, and thank you to ELMO for inviting me. And today, like Dr. Ioannis said, I'm Dr. Carla Arancibia. I practice medicine in Peru, and I am a director and founding member of Latin American Lifestyle Medicine Association. Please let me know if you see the screen or if it's taking a while to.
Yeah, we can see the
visualize
screen.
It.
Yeah.
You see it?
Yes, we see the screen, and if you click for a bigger screen, I mean, then we can see on a bigger version. it's just a background. I think it's some cars going there. So
it's not mine. It's somebody
okay. Okay, sorry. So then.
I apologize. I am not able to open this to enlarge it. I only see the speaker mode.
We see the screen with
okay.
with the one, and just have to click to make it bigger. I mean the whole screen, and then we can start.
Maybe if you click on slideshow.
Okay.
So maybe
It's the Zoom one I can't open. Okay.
Okay, so now is the first.
The slideshow?
The slideshow, or on bottom on the right, which one is more comfortable for you?
Sorry, technology.
No, I mean, it's our luck today, the chapter, so I'm listening.
Click slideshow slow from beginning.
Okay, so it's good. And
Go
the right.
Go to the beginning, from beginning.
Thank you. Yes.
The corner.
Yes, it's already, it's just not moving forward.
Okay, I think now it's opening, or at least it's a white screen, maybe it's opening. Yes,
there we go.
Now it's here, thank you.
So our topic today is lifestyle medicine, thank you. Medical education experience in Latin America. And I'm representing also Latin American Lifestyle Medicine Association on behalf of our president, Dr. Johnny de la Cruz Vargas, and the university, Ricardo Palma University, which is the university where we started the first, I'm sorry, did the sharing stop? Did something said that the sharing stopped?
Yes, it stopped.
I apologize, I don't know what's happening.
No. So let's see until it's fixed if we have some questions about education. No, so we are going to the lunch time, so probably this is why most of the questions were related to nutrition. So
I can speak on this while we wait.
Yes, please, as you feel comfortable.
Please reshare your screen.
Yes, I'm trying to.
Reshare. Find the
okay, so the
I don't know why I'm having such trouble with
no problem. So the questions here are not yet related.
Maybe we can ask you if you have a specialty already, or you have competence of lifestyle medicine in your in Latin America.
Yes, Dr. Hanku. I'm a public health specialist, but I do preventive medicine as well. And I also contribute to culinary coaching and health and wellness coaching, which is a new endeavor right now in Latin America. And what we are doing is, this took, I wanted to show you a timeline that we had, which took, years of work in order to get to this point. Of lifestyle medicine in Latin America began in 2017. I'm one of the founding members, and we have progressed into having the symposiums, the first two in 2017 and 2018 held in Lima, Peru, and then the third one in Cancun, Mexico. And we have then advanced with the the Latin American Lifestyle Medicine Association members to form this course, the first specialty course accredited in Latin America, which is backed up by LALMA and also the University of Ricardo Palma. But before that, we had also begun to create the first school of lifestyle medicine, which is also at the University of Ricardo Palma. And that's something that we have worked hard on, and it advanced so that we can create this specialty for not only physicians, but also health professionals. And that would help, to expand lifestyle medicine throughout the general medical field community for all of the countries, and to find the needs of each and different country. As you see in Europe, they're diverse within each community, and I wanted to I apologize this because
it's okay. It's no problem. So I mean, we can talk this in a debate, and if it's working better afterwards, we still have time. So please, I mean, the main idea is not to stress. So we can continue, and if it's working, then we can do. If not, we will just talk more about your wonderful experience. And it's not just Peru; it's more countries involved: Argentina, Brasilia, and Mexico, if I know well.
It is all of, yes. It is all of Latin America. So it includes South America, and it includes Central America. And of course, we have different associations. And what is important of how we started is our consortiums with different schools, universities, medical schools, health professional schools, and also the different associations that we've been working with, even from societies for internal medicine to oncology, nephrology throughout Latin America. In Argentina, we have had symposiums, and we try to implement lifestyle medicine in each of these different symposiums so that we can spread the information, and then obtained the interest, the high impact interest that we had received throughout Latin America was what pushed us to create this even faster, the course that we saw the need for and the interest for. And this is something that we advanced with a lot of energy, because first of the key points that we created was to form a group that was first representative and well representative of our mission of lifestyle medicine, and also a wide array of specialists. So we have created also a book that we wrote among all the different specialists, and it's very comprehensive. We are in the talks right now of even having it published, which we've made great progress within the last year. It took a lot of hard work and dedication between all of us, but it was something that we all have a passion for, and determination and organization. So it takes a lot of patience and a lot of time as well. But it's something that if you have the energy to put this lifestyle medicine into every single community and organization, so that we can move towards having lifestyle medicine education starting from our students, who are the motivation in the future, and then leading on to the specialist as well. Right now, our course that we are heading is specifically for physicians and for health professionals. It is at a higher level, but what we look to do is also implement this in medical schools. And we have done work already by giving symposiums. We held the first symposium in lifestyle medicine for medical students in 2019 in Lima, Peru. And it was at the University of Ricardo Palma as well. And we also have still given more conferences in lifestyle medicine in the past 2 years for medical students as well. And we had a great response. We had from the students who see the need for these changes, who see the lack of the proper healthcare and medical attention in the countries in Latin America as well. And I wanted to show you the curriculum that we have because it is, it covers 2 different groups where we have 2 courses that run for 6 months each. The first one is the fundamentals in lifestyle medicine, looking at the primary care, and it has already begun in October. We planned this with the we had the greatest support of ELMO, which we thank greatly, and also with ACLM, the American College of Lifestyle Medicine, and Harvard Medical School. I wanted to show you there how we had webinars. Dr. Ioannis was in one of our webinars that we had, the first one. It had great results for calling people's attention to seeing how important this is and how well planned out the curriculum was, giving something more than just what they were used to, you know, in the traditional curriculums. And also we had Dr. Beth Frades with us, the elected president of the American College of Lifestyle Medicine, who is here with us right now. I see her. Hello, Dr. Frades, and an amazing.
Yes, I remember that the webinar was really a big success and was a big enthusiasm. So really, congratulations for all this work, and actually the passion, how you described what all you achieved compensated the technical the problems what we had. And because you mentioned Dr. Beth Frades, she's here. So thank you for for the presentation. And thank you that also you wake up so early, because there it's really early at, I think, 7 o'clock in Peru, or you are in Florida. I don't
Yes,
know.
I'm in Florida right now.
Florida, but it's the same time zone like in Peru.
Like in Lima.
Like in Lima, yeah. So I'm also someone who is a very early. So thank you for the presentation. And also, a few years ago, I met, when I was in Boston, I met for the first time Dr. Beth Frades. So, you know, someone who is graduate of Harvard, of Stanford, I think. So you are really a bit inhibited, but actually it was something which was really a nice experience. So she was really inspirational. So my talk made me to follow the course at Harvard, what she was teaching at that moment. And if I am where I am today with my interest and my work in lifestyle medicine, so a big part it's because of her. So this is why when we met again virtually, and she was this year, and it's the third time that we meet, more than we met in the last years. I just wanted also to congratulate her for being the new elected president of the American College of Lifestyle Medicine. And so Dr. Beth Frades, she's here, and she will is also an award-winning teacher at the Harvard Medical School. So now we have to say everything, what is your merit and achievement, and the co-author of the Handbook of Lifestyle Medicine. So it's really a book where you find everything what you need to know and to practice about lifestyle medicine. So thank you for waking up so early, being here and sharing your experience about incorporating lifestyle medicine into medical schools from pre-med to CME.
Oh, terrific. Thank you so much, Jan. And thank you, Carla. It's great to see you. It's great to see everyone this morning. Delighted to share some information, also learn and collaborate together so we can all reach higher ground and get this lifestyle medicine movement going globally. Would you like me to share my screen, Jan?
Yes.
I'll stop sharing mine. I'm sorry.
Yes,
it just came up now.
Oh, it's no problem. So I think I just need to be enabled by somebody. Okay, yes. Terrific. And Jan, just let me know how long you'd like me to.
It's 15 minutes, please.
Sorry?
15 minutes.
Okay, oh, perfect, great.
Thank you.
All right, so I'm on the Scientific Advisory Board of Jenny Craig and the Medical Advisory Board of Obvious Solutions. I have my own private practice of lifestyle medicine and wellness coaching. It's called Wellness Synergy. We're trying to get lifestyle medicine to be mainstream. So we are going to do this together as United Nations, and we will make great progress. As you know, I've been working very hard since 2008 here in the US, trying to get lifestyle medicine into medical schools, into fellowships, residencies, and most recently even into pre-med classes. We're working with allied health professionals as well. And I think when I work in this area of behavior change, which is a little bit of what we're doing really with deans of medical schools and with other professionals, I like to look at moss, what I call moss. Moss doesn't grow on a rolling stone, so we've got to keep moving. And I look at motivators, obstacles, strategies, and strengths. So today I'm going to share with you some of those motivators that we've had in the US, obstacles we've seen, how we've gotten around them with different strategies, and what strengths we all have, ours and collectively. So you may be familiar with this quote. You may have heard it before: a rolling stone gathers no moss. We've got to keep on moving. Of course, I use this with clients, get them to keep moving so they don't have any plaque buildup, inflammation, or disease, but we have to keep moving as a group and as passionate lifestyle medicine leaders, and keep pushing the envelope so that we keep making progress individually in our own nations, and then of course collectively. So let's look at motivators. We know this group here, these leaders, I'm delighted and honored to be included. Thank you. We understand the research. We've seen it. Hippocrates was talking about it, right, centuries ago, but now we have the research and the data. We know that exercise, nutrition, sleep, stress resiliency, social connection can help people prevent, reverse, and even treat disease. So we understand that. That's our motivator, that we know we have this power. Research is there. And we know if every physician knew about the basics of exercise, diet, stress management, smoking cessation, and sleep, the world would be a lot different today. So we've got our motivators, and we're really all in alignment on that. It's our obstacles, and I think we are facing similar yet different obstacles, even in the US, depending on what medical school you're in, what state you're in. And I'm sure your obstacles are also different. However, there are some things that I think we can find similarity in. So some of the obstacles, we have a packed curriculum in the medical school. And what our students are tested on in our boards 1 and 2 does not include exercise, prescription, nutrition, sleep, social connection, some substance use, but not much. And in order to be accredited, in order to have a great reputation, like Harvard wants, like Stanford wants, like every medical school here in the US wants, our students need to pass the boards. So we really are, no one wants to admit this, but in a way, we must teach to the board so our students will be board certified and that they can practice medicine. So one of the big obstacles is that we're not in the boards. Lifestyle medicine questions are not on the medical school boards. By the way, in 2014, so 6 years ago, this was big news, pre-meds, our pre-med, our MCAT, our test to get into medical school included behavior change questions for the first time. We are actually working with the American board for the USMLE step 1 and 2. We have people, Jennifer Trilk, Eddie Phillips, and others are working with the board now to see if we can implement questions. And that's going to be one of our strategies around this big problem. Meeting the needs of the students. They want to pass. They want to pass medical school, and they want to become physicians and earn money and get board certified. So these are big obstacles for us. Now, another obstacle, I know we probably have leaders here that are school deans, medical school deans, college deans. Some of them don't know the science and research. I meet them every so often here in the US, and they're not familiar at all with lifestyle medicine. And by the way, when I try to explain it to them in my elevator pitch, some of them don't take it well and don't believe it will make a difference. You need time, and you need to really sit with people and show the research and answer questions in order to move them in their stage of change, often when you're in the pre-contemplative or contemplative stage. And then if they are convinced, they say, I don't even know how to incorporate this into the medical school. I wouldn't even know where to put this because it's so jam-packed. And does this go under cardiology? Does this go under oncology? Is this, well, it's certainly not pharmacology. What is this? Where does this material go? Most of them already are overstretched and overstressed in their work, the deans, and they don't have a lot of extra time. So they're not willing or able, in some cases, to put the time into learning this. And they certainly don't want to waste any time. Many of them don't like to take risks. I know that at Harvard, it's, you know, we like to be first in things, but actually we like to see that something's working out and we like to be sure that it's the right path and then dive in a lot of cases. And unfortunately, one of the major obstacles is we don't have support, administrative support. There aren't people that will be able to do all the paperwork that it takes to make these changes. So you'll notice that was a huge list of obstacles, but what was missing? One of the obstacles we do not have, the students. Do you know why? They want this information. They themselves are often exercisers. They're really interested in healthy nutrition and the impact of stress on their lives. They want the information. In fact, that's how I started the lifestyle medicine interest groups back in 2008, was the fact that the students wanted it so badly, I would give it to them in a parallel curriculum. And that's one of the biggest strategies I personally have used in the US to try to get lifestyle medicine into medical schools. It takes some creativity, these solutions and these strategies that we have. It takes some courage, not always going to be successful, going to fail sometimes. Best is collaboration, and that's why I love this, and I thank you so much for including me, because the more we work together as a team, leaders, internationally, globally, the further we're all going to get. And for us here, you know, at Harvard, we're in silos. Yes, we're in one place. We're in Boston, Massachusetts, but Harvard Medical School is a huge place. And a lot of times we're in our own little silo. And we're not even collaborating in our own institution. This has to change. We need to collaborate. We need to build on existing experience, build on existing materials. Don't reinvent the wheel every time. And work and use the research that's out there. Of course, do more research. We need researchers. Use the research that's out there and highlight it effectively. And enlist the students, because they're our biggest supporters. So I mentioned already pre-contemplative, contemplative. I know that you guys are aware of the trans-theoretical model of change. After I became a coach, certified coach in 2009, this has always been on my mind. When I am working with colleagues, when I am working with my own children, when I am working with people in general, I'm thinking, which stage of change is this person in? So when I meet other professionals, when I meet practicing physicians or deans of different medical schools, I think I ask a couple questions. I assess, where are they in this lifestyle medicine movement? Are they even on the path with us at all? And then I target my intervention, or my words, my language, my presentation to them, depending on which stage of change they're in. I want to briefly review some of the things I've done in each stage, and you're probably familiar with these, and I can fly right through them. Lifestyle medicine interest groups are fantastic for people who are in pre-contemplation. So a medical school that has no room and they say, I can't help you at all, you can have no lecture time. Well, then you do a parallel curriculum. At lunchtime, you bring healthy food and you lecture on exercise, nutrition, sleep, 1 hour each week. And you can go through this in 6 weeks, or you can have it once a month, whatever the students like. You create an official medical school group in the US the medical students have governments, and the governments will give money to official student interest groups. So we became one in 2010, and they've been getting money. So many of them actually shop and they buy healthy foods and they make the meals for their fellow students. It's brilliant. And they get leadership opportunities this way as well. And it's fun because the students are full of energy and great ideas. And it's just a wonderful way to get in the door. Now, evening lectures, if you can't commit to a lifestyle medicine interest group, you can get a hold of a couple of students and tell them about your exciting materials, and hopefully have an evening lecture where you could share some information on general lifestyle medicine, or pick a topic of interest to them. I always ask them, do you want to hear about sleep? Do you want to hear about stress? Do you want to hear about substances? Do you want to hear about friendships? What do you want to hear about? And again, you're feeding the need. You're staying in that trans-theoretical model of change. You're thinking about what do they want to hear and what can I feed them? Another opportunity that we've done here at Harvard on the Move, we do walk and talks. So I was meeting people, students, actually staff and faculty at one point at noontime on Thursdays at a particular place in the medical school. We would all come together and we'd go for a walk around the campus. And we would talk about lifestyle medicine topics. And one day, by the way, we were talking about laughter. Students were laughing so hard. We were having so much fun. We thought we should write a paper on this. Guess what? We did. We wrote a review paper on it just from that walk and talk. So wonderful things come from these walk and talks. They wanted to get out themselves, right? They're sort of trapped in their own either offices or classrooms, and just getting out and talking with a professor really is enticing to them. I tried to do this with office hours, even at the college. In fact, with the poor weather we often have, I was doing treadmill office talks where I was on a treadmill and a student was on a treadmill, and we were walking together on the treadmill. This is wonderful. The only issue I had was when the student said something really alarming to me, and I kind of lost my footing because he had 6 papers that were due in 2 days. And it was alarming. So if you are going to do the treadmill, you have to really try to stay steady. The lunchtime gatherings, they don't have to necessarily be the lifestyle medicine interest group gathering. You can have one lunchtime gathering. If you really want to entice them, do a cooking demonstration. They love that, and they love free food. Or if you want to go the other way, organize a 5K where the students can come together for a cause that they're interested in, raise money and be together. Another idea is offering yoga classes, maybe in the morning before they start their medical school day, or lunch, or in the evening. Now, for the lifestyle medicine interest groups, I think you're all aware, I've shared a lot of my material with the American College of Lifestyle Medicine back in 2016, how to start a lifestyle medicine interest group. We have the professionals in training now, it's called trainees at ACLM, and there's a certain part of our website, if you click on the trainees, you can download PowerPoints that I shared back in 2016 and 17. They are continually updated for these lunch talks. If you're interested, anyone is welcome to use them off the site. Finding interested faculty and students usually is not hard. Getting the lunch also, if you want to make it, fabulous. Or we have some really good healthy choices around the Harvard Medical School now. And the PowerPoints, don't reinvent the wheel. You can enhance and add, but we have some already available to you. So please feel free to use them and give me feedback if you want to actually enhance them with me. A few years ago, an award was started, the Donald A. Pegg Award, through the American College of Lifestyle Medicine. And every year we actually provide $500 to 4 students. And that's money, seed money, for a faculty and a student to start a lifestyle medicine interest group. And we have been giving these to students in the US and outside the US. So I encourage people to apply. I have this written up in the Clinical Teacher, if you're interested. Back in December 2015, I wrote about the parallel curriculum in lifestyle medicine. It's available for you. In terms of contemplation, these people are thinking about change. You can use the same techniques as I just described, as we did in pre-contemplation. If they're in contemplation, though, you can take the next step and think about submitting paperwork for an elective. Meet with the deans, have an official formal meeting where you can share some data. You could bring the paper from clinical teacher if you wanted, just to show this is being done. Others are teaching this and it's working. Meeting with other faculty, like those that are teaching the cardiology course and explaining how you could come in and do a guest lecture or part of a lecture. You could even offer to write case studies for the medical schools. We're trying to do that here in Harvard Medical School. And I'm proud to say after 11 years at this, we are one of 11 electives now at the Harvard Medical School. There's a lifestyle medicine elective, nutrition and lifestyle medicine through the ages. And just working with your faculty and friends to include some lifestyle medicine into their current classes. This is a case report that I wrote up in the British Medical Journal. We all need to publish, right? If we're in academics, we need to publish. And I think we think often that this is a really hard thing to do, a big obstacle, a big hurdle. But it really, if you have a great case, just take the time to work it up. And by the way, including students is fabulous. This is one of my Harvard students, and worked with her to create this case, and you mentor at the same time as you then spread and disseminate the information. So now if we're in preparation, so the medical schools are saying, yes, I really like this. Now we have a lot of opportunities. Everything we talked about before with the lifestyle medicine interest group, but now we can actually strategize creating a new course, a full course, an elective, offer help in the existing courses. You can even, one brilliant idea is to start a lifestyle medicine task force. If you've got people in preparation, get as many of your faculty as possible that are interested and create a lifestyle medicine task force for your medical school or institution. And then you can really get things moving, gathering like-minded professors and colleagues. There are so many ACLM resources I would like to share with you, open and available. I mentioned the downloadable PowerPoints for the lifestyle medicine interest groups. There's also a lifestyle medicine syllabus that I shared from my Harvard Extension School course, in which Ioan was the star student several years ago. Absolutely the star student. Anyway, shared that syllabus again, because why? Why not? Let's have a wheel. Why do you need to start from the scratch? Take a look at it. I'm not saying you're going to use everything, but why don't you use some of what I've already done? Don't spend time going backwards. Let's all go forward. And then there is the Handbook of Lifestyle Medicine, which Ioan talked about. We're now in the 2nd edition. I get no proceeds from this book. They all go to the American College of Lifestyle Medicine. It has been useful to people. I've gotten some great feedback from actually providers as well as patients. Here is an example of the lifestyle medicine course curriculum you can download for free off the ACLM website. Here's the handbook. I do want to share with you, as of a couple of weeks ago, we have a full set of PowerPoints, 12 PowerPoint decks. They have about 100 to 120 slides in each deck that are free and available to you as ACLM members, and it's called LM 101. If you're not a member of ACLM, by the way, you can apply to utilize this particular PowerPoint deck and get permission to use it. I am not in charge of that. There's someone at ACLM that runs this. I just gave these PowerPoints. Ioan knows these PowerPoints well because many of them were part of his class at Harvard Extension School. I just decided to share it all again. Why? Let's not start from scratch. So take a look at what I've put together and use it, and let's move forward, reach higher ground. After that, when we're in action, we need to evaluate the reception of the course, evaluate the knowledge of the students, the materials, that use case studies and write them up, and evaluate the impact of the course, confidence in the students' counseling. And I did this for our Harvard Extension School course and noted increased knowledge and confidence and behavior change. We also did this with the medical students in the lifestyle medicine interest group after one behavior change talk. So we had a pre and a post. After one talk, not only did they increase their knowledge, but they also increased their confidence in behavior change. So this happens when I do the whole 12-week course with the students at Harvard Extension School. And then we tried, one class at the Harvard Medical School. And what did we find? The same thing. They increased their knowledge and their confidence in counseling. So when we're in maintenance, if we've been doing this for a while, we have to continue the evaluation and modification, continue working together and reaching higher ground, making things better and better, and doing research is critical. Sharing my materials is something I just love to do, and I really hope that it's helpful to you. If you have the opportunity to take a look and give me feedback, terrific. I really want to make things better. And thank you for giving me this experience, this opportunity to share with you what I've been able to do here. You can connect with me anyway, email, and also the one thing I'm on is Twitter at Beth Frades MD, and then of course you know the handle for ACLM, and I'm following you guys, Elmo, and you're following me, so we're connected in that way, and many of you are also following me, and I'm following you, so we can stay in touch and again work together in that way. This is an example of the article I talked about for the extension school research, and not only did we see changes in counseling, we saw that the students after 12 weeks, and Jan can attest to this, they exercised more. That was not part of the course, but these students that take a lifestyle medicine course start exercising more, they start eating more healthier foods, they quit smoking. Those that were, they cut down on drinking. It's very interesting. And reporting this is really, really important. So what are our strengths? We're coming to the close here. Strengths are each other. We have so many passionate people now throughout the world interested in lifestyle medicine. And we are like-minded professionals. In the US, we've come together at ACLM. You have ELMO and so many other societies. Latin American Society of Lifestyle Medicine, Korean Society of Lifestyle Medicine. There's so many other societies, Australasian Society of Lifestyle Medicine. I can't name them all, so no one take offense. I know there are so many, and it's fabulous the work we're doing. And this global alliance we have is the way we are all gonna move this lifestyle medicine power and passion forward. We must continue to do research. And these lifestyle medicine certification program, and I know you all have one, and continue to develop these is critical. So what's the future? We're writing it right now. Hopefully one day we'll have lifestyle medicine in every medical school. Jennifer Trilk at USC, University of Southern Carolina, South Carolina has it in the core curriculum, and others, Brenda Ray and Loma Linda, are doing a really great job with that. We're moving it into a residency. ACLM has the residency curriculum in lifestyle medicine that anyone can utilize, and going into fellowship with that too. We're working on a core curriculum right now at ACLM for medical schools in the US. We're just writing those cases right now. And hopefully we'll be able to share those in the months to come. So thank you for letting me be part of your process here, and I look forward to future collaborations. Thank you so much.
Thank you very much, Beth, for as usual, a very inspirational and a very creative way of showing us how we can implement this in medical schools, how we should talk with responsible factors. And I mentioned at the beginning that, yes, I met you and I had the chance, because it's a chance in life, what often change our direction in life, to have you like a professor. And I remember at that time you had your amazing slides, but one of the book what you recommended was a book written by an Australian writer, Gary Egger. So the last contributors in the chapter of Education, Lifestyle Medicine, it's Professor Dr. Erika Frank. She's the Canada Research Chair in Preventive Medicine and Population Health at the University of British Columbia. She is a founder of NextGenU, which was already mentioned here in a presentation. It's the world's first portal to free accredited higher education, including the world's first free degree, a master in public health. So it's from Canada. So thank you for waking up so early, Erika, and welcome in our conference. Do you hear us? Yes. You are there. Theoretically, you should be able to participate.
was not perfect if we don't start with a technical problem. Okay, just 1 second. Okay, I think it's not. I don't know what's going on.
Ioan, I don't see Erika in the.
But this is why I'm saying I don't know from where it's talking.
Maybe send to.
Yes, I think maybe she didn't receive. Let me see. Okay, now it's going. Will be here with us. So.
Super. Thank
Okay,
you.
thank you.
Delighted to be with you all. Thank you so much for this invitation. And yes, this was worth awakening for off the west coast of Canada. Delighted to be with you. Thank you. And delighted by the generosity also of the groups who encouraged me to come, both domestically in North America and through ELMO. I'm going to be showing you an alternative to training, to some of the pieces that have been shown to you earlier this morning. And I'm going to go ahead and start with screen sharing, as my colleagues have done. All right, so let me minimize you guys there and maximize, maximize here. I think that should take care of us. Yes, excellent. All right. So this is what I'm going to be talking to you about today, is lifestyle medical education for credit, for free, for everyone. And as you might be able to see from my slight swaying, I'm doing this while riding an exercise bike in the practicing what I preach category. As Jan mentioned, I'm the Canada Research Chair in Preventive Medicine and Population Health at the University of British Columbia, and I'm the inventor and founder of nextgenu.org, which I'm going to be telling you a little about today in terms of some of our offerings for lifestyle medicine. This is our homepage. We're being used in every country in the world now. And available through the magic of Google Translate in over 100 languages. And these are some of our characteristics, and I'll pause on this again at the end, but characteristics that we share with traditional universities, ones that we share with massive open online courses, and unusual or unique characteristics of NextGenU. And this is the most unique thing that everyone concentrates on still. After almost 2 decades of doing this, we are still uniquely for credit, for free. But these are some other characteristics that I'll show you as well. So these are our founding collaborators and funders, some of which will be quite familiar to you. Others of which, like the Annenberg Physician Training Program, you might not know as well. That's who holds our $16 million endowment and what allows us to remain as a reliable partner. But we're on our we're on our 13th course for the CDC or for WHO as well, now including teaching public health leadership for WHO. So this is how we create our courses. We take competency sets like the ones from ACPM and ACLM on lifestyle medicine, and we combine them with authorized resources. We organize them into modules. I'll just show you very quickly a bit of the lifestyle medicine course. You're welcome to go in and have a look at it with our partners, a description of the course, how to obtain a certificate and credit, and then leaping into the course itself. Within the course, there are both mentored and peer activities, some of which are required to fulfill the competencies of ACLM around doing this kind of activity, some of which are optional, but there is the necessity of doing practice, of course. Let me get back in there. Good. All right. So that's the course itself, and please feel free to return to that and to use it in any of the modalities that Beth and others described in terms of electives or classes or special interest groups. This is a resource that people can just pick up and use. And we've had huge increases in uptake because of COVID. This is our uptake this spring, with spring semester, particularly in the United States. We had huge uptake. We're being used now in 74 US med schools. So about 40% of US med schools. In addition to the lifestyle medicine course, there are a few other trainings that I just wanted to mention briefly and then show you a little about our evaluations before I finish. We offer the world's first free degree to institutions, and we have 2 US med schools and several in other countries that are either now offering or about to start offering our MPH. The schools charge their students for that, though typically far less than they charge for usual degrees because they're getting all the content and courses for free. We have a pre-health sciences training that's about to come out, a med school in a box, which is just the resources, a full PMR, Preventive Medicine Residency, and are working with the American College of Preventive Medicine and other sister colleges around the world to launch preventive medicine residencies and support them with coursework. A student-facing Bachelor's of Science in Nursing that we're doing in partnership with Nurses International. And we're expanding our curriculum now to include K-12 curriculum, including health training for high school students and for teachers. So this is a nonprofit approach to dealing with what some people do as disaster capitalism. And just to show you a little of what it looks like, here's the MPH curriculum with the core courses and some of our electives. It includes a practicum and capstone, which of course can be in lifestyle medicine. It's competency-based, as all of our trainings are, and these are the 4 authorized sources of competencies: governments, peer-reviewed journals, university, and specialty societies. And again, including activities needed to address skills-based competencies. These are some of the developed courses, just to show them to you very quickly, some of which, of course, are highly relevant to lifestyle medicine. And these are all courses sponsored by the US CDC. So this is the Preventive Medicine Residency I mentioned, developed by colleagues with me at Stanford and at CDC, and also at the College of Preventive Medicine as well. And we're going to be launching this, we believe, in Texas next summer as our first one. So just to close with evaluations, we have evaluations of the students and of the training. So the students are able to evaluate the learning objects. They evaluate each other with peer and mentored activities. And then there are, of course, MCQs and a final exam. This is how students can rate a resource. This is an activity teaching students how to do multiple choice questions, a response from a quiz, our timed and translated final exam, and a bit about our security, so that we have these various pieces of sort of standard web-based security, or people can print out and locally give the exam. And then finally, on our evaluations of NextGenU, these are evaluations done of our first courses, emergency medicine, done at the Uniformed Services University of the Health Sciences, the Military Medical School in Bethesda, Maryland, in the US, and at Mizzou, showing identical knowledge acquisition between traditionally trained and NextGenU trained students, and also for the environmental health course for the MPH. Again, identical knowledge acquisition and superior student satisfaction. We were able to measure that here in a flipped classroom. And for our last bit of data, some conclusions from our mental health trainings that we offered in Kenya to primary care docs, showing strong preference for our courses versus traditional courses, with excellent physician satisfaction on how much they learned pre-post in substance use care, and even in as difficult a variable to change as stigma, both with quantitative and qualitative data, including my favorite qualitative data. This couple came in at their 1-year follow-up, holding a baby and attributing this to their doc having taken a randomized controlled trial, having participated in that and learned about substance use disorders. So that's it for what I wanted to share with you, and delighted to be here. And I think we are moving to our microsecond now of debate and questions.
Thank you very much, Erica. That it's amazing what you do. I don't know when, or I don't remember when you started to do all these activities, but making a team to build this up, continuing, persevering, and especially networking, it's really amazing. So congratulations, if I may say, for all this work. Now, because we had some technical issues, so but I would arrange a bit this small debate, because I think it's really important to the education, around four questions. So I would like to suggest you a question. So I did a kind of small synthesis here about what we talked, and I would like for each continent what is there. We in the Europe, we will just listen this time because we host this, but I would like, for example, the main ideas to hear a bit your opinion. So, for example, Erica, for you, Beth was mentioning importance the spread research. How did you succeed how you spread the research data and make these to be known, or how you do this, especially related to lifestyle medicine, because you build up something based on research?
Yeah, this was very lucky. In 2006, after 6 years of building NextGenU and after 6 years of trying, I got a Canada Research Chair at University of British Columbia in Preventive Medicine and Population Health. And this has allowed me to build the research base for this. And it's a major part of the reason why NextGenU is the only place that does this for credit for free. Because when Daphne Kohler, the founder of Coursera, came to UBC and talked about this is what she wanted to do as well with Coursera. It was a matter of persisting for 6 years to get this job, and a matter of persisting with grants and getting this endowment for now 19 years.
Okay, so it's a lot about perseverance. It seems that here we are many people perseverance and maybe sometimes stubborn in a good way. So just going for what we dreamed about, actually.
I have a question for Professor Mutafoglu and Stefan, because I really think that, yeah, it's very good, our enthusiasm, our research, our knowledge, but we need a bit outside of the non-professional, non-health professionals, I would say, so politics. How you succeeded to convince politicians or social players to do? I mean, in Turkey, you did a med school, I mean, with a part of lifestyle medicine curricula, so that needs a lot of approvals, I would say. And in Australia, from what I know, Stefan, you have also some a bit larger approach of lifestyle medicine, implying also politics and social responsibles.
Okay, can I answer first?
Please.
Okay. Yeah, we were talking about the deans, actually. You know, the dean is very important. Our dean, Professor Abacıoğlu, was very much interested in having a curriculum like this. So he was the initiator, actually. But the main strength comes from being a, you know, foundation university. The university was founded by a foundation, and it was a brand new program, so what was a new curriculum. So we had the opportunity, you know, changing things is really, really difficult in medical schools. But if you're in a new medical school, if you're establishing a brand new program, it's much easier. And we're lucky that the Higher Education Council also approved our curriculum. So to our knowledge, this is the first in Turkey, I mean, the first medical school with a dedicated lifestyle medicine curriculum. So I totally agree with that practice that, you know, deans are very important, and people who are like-minded are very much important. So I can happily see that we're at the same page with most of you, because lifestyle is not a personal choice most of the time. This is what we are emphasizing in our curriculum. Yeah, we have personal choices, but majority of the other factors are very much socioeconomically related, politically related, whatever. So it was talked, so I won't go into the details. So kind of, I can say a socially responsive curriculum needs to do it in a country where, you know, there are so many health inequalities and income inequalities. So I think the faculty was on the same page with these concepts.
Okay, thank you. How is the situation in Australia, or what is your experience, Stefan?
I'm afraid I have very little to report, so it'll be a quick answer. Here are my key takeaways after 5 years running the society. Whoever mentioned perseverance, that was you, Jan, I think, that you are. That is absolutely correct. Beth Freites, your talk was like a roadmap for how to do it. So if anyone is thinking, how am I going to get it to happen in my university? How am I going to get my society or my organization to build education in lifestyle medicine in my country? Follow the ACLM roadmap. That's exactly what we've watched very closely, and we've tried to do all of those steps, and we haven't done them all yet. So we only just this year launched a student movement in, I think, 7 universities. And next year, I hope we'll have an announcement about something exciting happening in one of the universities. But that's as far as we can go at the moment.
Mm-hmm. And so you didn't imply politicians or, I don't know, legislative actors in implementing the program?
No, quite honestly, we're very small and somewhat invisible at this point, but perseverance will pay off as we grow larger. Once you grow larger and you have a voice, you don't really have a voice until you have enough people that you represent.
Mm-hmm. Thank you. It seems that it's an experience in Lithuania. So there, the coordinator of the master degree program, he became the Minister of Health, and then he just promoted at the level of, they have a lifestyle medicine specialist.
Now, if there is place on the market for this new specialty there, which are not necessarily only medical doctors, that it's another question. But I have still two questions. So one question is for Carla, because you started a master degree program, so a university program, we have certificates. Is a certificate in lifestyle medicine less valuable than university academic program?
Well, this is part of the university. It's accredited and has two parts. So we have the 6-month course. The first part, they get a certificate, but then they get a diplomatic title after they complete both courses. So this also gives them the desire to continue and keep specializing in this. And as well, we're implementing the culinary medicine within it and coaching, so that way it can be complete and they can have the full scope of what it is to practice lifestyle medicine.
Because, for example, here in Belgium, you have a very good training to become a tobacolog, so a specialist in tobacco cessation. And everything started from an organization, and then the organization put together the accreditation of universities. So it was a bit vice versa. They are not going to look for implementing in university this program, but they made a network of university which support their program, which is totally reimbursed and everything. So it's really well done, for example. So it's built around the organization, not around the medical schools, for example. And the last question, it's for Beth, of course. It's a challenging one because Stefan was saying that we are using like an adjunct or not the lifestyle medicine education. Is not maybe lifestyle medicine a new way of medicine? So instead of trying to find our place, we should define differently, we should build a different medicine?
Yeah, that's a great question. And
it's not easy.
I'm sorry?
It's not an easy question, I agree. But was this
right,
Stefan?
No. Okay, well, it's a great question, regardless. It's a very good question, and it's something for all of us to think about. And I think Stefan did a really good job getting into the complexities of how we define ourselves, present ourselves. And he has a lot of good questions for us to ponder here on in. I think I like this question. Are we going to be a new way of medicine, the solution to the problems that we have? Or the other way to think about it, are we the foundation of medicine? Is what we do everything and everything is built on this, meaning if we can create societies, right? Social ecological model of change, right? So start with the individual, go to community, go to neighborhood, go to county, go into the country, go globally. Okay. Can we create for individuals, for environments, sustainable lifestyles that enhance our health day to day, moment to moment? So each choice, each nudge is in the area of, I like the word vitality. Yes, health, energy, vitality. So personally, and I love Erica's work, and I've been following her for many years and her research at Emory, et cetera. So I'm so happy to have all these people, all together here. But, if we can think about using everything that we already have, right? There's a lot of great programs that are out there right now. We've heard about many. Master's certificate, Next Gen U, in new colleges and in medical schools in Turkey. And okay, so we've heard about a lot of great opportunities to share lifestyle medicine. I think if we can make it foundational, that's key. I've even thought about, and we're starting to put it into middle school so that people start learning this material when they are in their teenage years. and then they grow up knowing what healthy living is, and it becomes a fabric, part of our community, our schools, our families. And then when we as practitioners are helping people either get back to health or prevent disease, we're starting at a base where everybody is understanding us, lay people and practitioners. And now if we want to start a whole new wave of medicine and create a new medicine, I mean, I think we can do that, but let's not forget what we're doing is foundational. What our process, the way we are practicing, it's foundational to health and vitality. So I love the question, and I hope I've answered it to some extent. I think, yes, we can put ourselves forward as the new medicine, but I mean, Hippocrates, right? If we could give every individual the right amount of nourishment and movement, we will have found the way to health. So yes, it's a new way of practicing medicine.
Because why I'm asking this, because I mean, listening to Stefan, so well, seeing how many layers actually we need actually to redefine lifestyle medicine, and we are somewhere fighting to do a specialty. But we are, if you look back, I mean, many years ago, we had just general medicine. We had the medical doctor, and then we just went on a specialized, different specialty, and we arrived to the chronic disease problem of the day. So this is why I'm wondering, based on the presentation what I saw, is maybe another way, as you mentioned, for example, starting earlier this general health education, which definitely will be a question after, during and after this pandemic, that people will be more aware about chronic disease, is something not what we should build a bit in an earlier stage and just maybe define a new way of understanding and practicing medicine. I don't know. It's just a question which popped up when I was listening to.
No, it's a brilliant question, and I mean, perhaps we can get others to weigh in. We have brilliant minds.
So if it's
here, so I would love to hear what these other brilliant colleagues have to say too.
Okay, so here from Ourania that we will talk about this in the chapter of lifestyle medicine and children. Yes, indeed, there we with Professor Ourania Kolokotroni, she will try in the discussion to see that where we should start already with the principles of lifestyle medicine. It's a bit too late if we do just with adults. So how we can do this at an earlier age, through the cells of the development, so the families or the couples and the children. But I don't know if someone has another idea or remark about this.
I think your approach is very correct, but maybe we could include this lifestyle medicine into some populational prevention programs.
Yes, preventive, it's part of lifestyle medicine, but it's just part of it.
In order to enlarge the base, like Beth told us.
Yes. So, okay.
Last thing, if you let me, this is why we're very much emphasizing on population-based programs, because integrating these knowledge and skills to your personal practice as a clinician makes a huge difference, I accept, but the majority of the problem can be addressed by population programs. So that's why we need future doctors to become advocate for administrative changes. Maybe we need politicians coming from these doctors, actually.
I think so, that without politics today, it's okay, the health experts are more involved in political decisions today, but it's definitely that we need politicians to be more sensible about this topic. And I mean, I just gave you the example of Lithuania. There, the former European Commission health commissioner, he was from Lithuania, and one of the biggest achievement what he had is to build up a program in Lithuania.
So let's hope that next time when we will meet, we'll have also some politicians who are sensitive list, or they are not I mean, let's say that maybe in a pre-contemplation or contemplation phase. So really, thank you. Please.
If I may.
If I could just add a sentence on there. So I served for 3 terms as a city councilor for my town. I was elected half a year after I moved to Canada, knowing nothing about Canadian politics, and had a wonderful opportunity for 6 years to be in charge of sustainability and public health for our community. And this is, I would, in terms of the theme of perseverance and personal sacrifice, stepping up and volunteering, spending your money on developing things. I know that these are pieces that all of us do, but I just want to encourage you that having now seen this with a few decades of retrospectoscope, that it does make a difference. And if you keep on saying, "Can I help?" often enough, you'll get increasing numbers of yeses.
Thank you very much. And thank you everybody, because I see Stefan that he's almost, it's risking his healthy lifestyle through in the night. So thank you everybody for being part of this small virtual table. And let's hope that we can meet in future again. So thank you for being here.
Thank you.
Thank you.
Thank you. So we continue. We will have a 5 minutes break, and then what we have in the rest of the day, it's a chapter of cardiology in lifestyle medicine. We will talk also about lifestyle medicine for children and families. And the last one, we have 3 initiatives of lifestyle medicine in lifestyle medicine from Romania, France, and Switzerland. And in the end, just because it will be evening, we choose to have the topic about sexual health, fertility, and lifestyle medicine. So we take a small break, and we are back in 5 minutes. Thank you.
Answer.